New research shows that hot flashes could be an indicator of increased risk for Alzheimer's and dementia. The study also suggests women hit harder by menopause symptoms are more likely to develop dementia later on in life. And joining me now to discuss this is Dr. Karen Adams, director of the Stanford Menopause and Healthy Aging Program. Thank you for joining us. But starting off, tell us how hot flashes could be connected to the risk of developing Alzheimer's. And
Yes. Thank you for having me. It's really interesting research that we have noticed that hot flushes are associated with other symptoms, poor sleep, brain fog, things like that. But this is important research because it links the severity of hot flushes with a particular marker in the brain that is an indicator for an increased risk of Alzheimer's later on in life. And because 2/3 of Alzheimer's patients are women, this is important.
And how might those sleep disturbances, such as those caused by night sweats, impact cognitive processes like memory?
Exactly. So it's complicated because sleep disturbance is associated with brain fog and, difficulty with higher executive functioning. And it's hard to know, is it because of the hot flush that is then creating the disturbed sleep, or is it the disturbed sleep that is creating the brain fog? So, these are associations. They're not causations. So we can't say hot flushes cause Alzheimer's, but we can say that when people have more significant hot flushes, they have an increase in this brain protein that is a marker for later on Alzheimer's. So that I think that's important.
Weight gain is also pretty common during menopause. What tips do you have to help prevent that type of weight gain?
Well, I wish that I could say that if you just take estrogen or a hormone, your weight will go back to your 30-year-old weight. That's not true. What happens as we age is that our metabolic rate slows down, our muscles begin to get marbled with fat, and fat is less metabolically active than muscle. So it's very important to maintain your muscle mass. So weight-bearing exercise, yoga, weightlifting, even simple walking can help to maintain muscle mass, which can help to mitigate that weight gain that happens in menopause, in midlife.
And you had mentioned this, but how can hormonal therapy help with typical menopause symptoms? And are there ways to manage symptoms without hormones?
Absolutely. So when 80% of women going through menopause get hot flushes and night sweats, and so that's the most common symptom. And if you are a candidate to take estrogen, not everybody can, but if you are, I can take those hot flushes and night sweats away in about 3 to 4 weeks. So that it's incredibly effective and it works quickly. If for whatever reason someone is not a candidate for estrogen, the best alternatives are non-hormonal things like gabapentin, which is a drug that works for hot flushes. SSRIs are antidepressants, they work. And we have a new drug on the market that just came out a few months ago that is a non-hormonal treatment as well. It works a little further back in the brain. Sadly, things like black cohosh, soy, other kinds of herbs and botanicals typically don't work as well.
So do you recommend hormonal therapy?
I think it's a risk-benefit calculation that we always make when we talk with our patient. For some people, it is absolutely the right thing. And for some people, it's absolutely not the right thing. And so it's very individual. It's very important to have that conversation with someone who is educated about the pros and cons and the contraindications so you know what's right for you.
All right. Well, thank you very much, Dr. Karen Adams. Always good information. So thank you very much for joining us.
My pleasure. Thank you.